Starting today, it's truly a privilege to introduce our first distinguished speaker, Professor Jane Halton, an individual whose influence in health policy extends from Australia to around the globe. As Professor of Health Policy and Health Security at the Australian National University, she has led a career of exceptional service, including nearly 15 years as the Secretary of the Departments of Finance and Health. Over her 33 years in Australian public service, Jane's vision and leadership have touched virtually every facet of public health governance and policy. Jane currently serves as the chair of the Board of Coalition for Epidemic Preparedness Innovations, or CEPI, based in London, and the U.S. Institute of Health Metrics and Evaluation. Her global leadership has included serving as the chair of the board of the World Health Organization and the OECD Health Committee, just a few examples of her wide-ranging and impactful contributions to global health. Her expertise and forward-thinking approach make her uniquely suited to speak to us today about the future of health policy. And the title of this lecture is very apropos in its reference to the great one, Wayne Gretzky. Jane is always ahead of the curve, steering policy towards the future rather than reacting to the past. As we navigate a world filled with both challenges and opportunities in public health, Jane's insights help us look ahead with clarity and with purpose. So please join me in giving a warm welcome to Professor Jane Halton.
Thank you so much. Pleasure. Good morning. Good job. Let me start also by acknowledging the First Nations people on whose traditional lands we meet today. It's a very particular custom in Australia to always acknowledge First Nations people. Distinguished guests, colleagues, friends, and award winners. I just want to say, to start with, how absolutely delighted I am to be here. For me, it's a little bit of homecoming, particularly in the fall. And it's also great to be here as we recognise and celebrate the fantastic achievements of medical science and global health, which will actually help people all over the world lead better, happier, and more fulfilling lives. It's also a particular honour to be able to speak to you all about the future, or rather about creating a better future, because that's what CEPI, who I'm going to speak about today, the Coalition for Epidemic Preparedness Innovations, that's why we were created. Our mission is to help shape, change, and defend the world and its people against epidemic and pandemic threats, so that one day we will look to a future free of pandemics. And I'm mindful of the wonderful science we've actually heard about over the last day or so. And what I want to do is talk about how we take that real science and translate it into things literally that will save lives in the cases of epidemics and pandemics. Now also, because we're in Canada, and I know how much Canadians love ice hockey, and because of my personal experience of being smacked into the boards on outdoor ice rinks when I was a kid in Ottawa, it's not surprising that I'm just going to use a few little sporting metaphors to make my point. And I am going to borrow from the great one, Wayne Gretzky, who I should acknowledge never played for the Leafs, but he actually did do part of his junior playing here in Toronto. And of course, he was fabled for his skill as an individual player, but also for his ability to lift a whole team's performance. His ability to predict the flow of the game, to position himself in the right place at the right time, to make the right play, marked him out, not just as an accomplished player, but as a legendary one. And of course, that quote, although it's debated whether it was his father's quote or whether it was his, a good hockey player plays where the puck is. A great hockey player plays where the puck is going to be. And it strikes me that in the context of pandemics and pandemic preparedness, that's exactly the difference between a reactive approach and a proactive approach. And if we talk about global health security and an ecosystem reacting to an infectious disease epidemic or a health crisis, then it's playing where the puck is. The response system is tackling a crisis as it unfolds. And that's not necessarily a bad thing. There are circumstances where that is appropriate. But it does mean we're already playing on the back foot. And playing catch up in an epidemic or a health crisis, that's a problem. And it feels like we're scrambling to contain the damage rather than taking control. And that's why at CEPI, we are taking and advocating for, with our partners, an approach which is proactive. It's going to where the puck will be. And as you probably know, CEPI was originally created to address the growing threat of epidemics by developing vaccines against diseases that mostly affect low to middle income countries. Diseases that emerge episodically, they erupt into smaller or bigger outbreaks, and they affect sometimes smaller communities, sometimes whole countries. And of course, when we were born in 2017, there were a series of diseases with no countermeasures, things like Lassa fever, Rift Valley fever, chikungunya, Nipah. And so it actually feels really good to be able to say to you today that we, together with scientific partners and global health communities, have made progress. And there is now a licensed vaccine for chikungunya. A Lassa vaccine has entered field trials in West Africa, and Rift Valley fever, Nipah and MERS vaccines are all in early clinical trials. But of course, and it's already been mentioned, COVID-19, when it hit, was a disease and a challenge of a quite different order. It caused a huge global health crisis. And just as it transformed our world, and it did, so responding to it has transformed CEPI. When the pandemic started, we were an organisation with fewer than 60 people. Today, we manage a highly diverse, multi-billion-dollar research portfolio in more than 50 countries. We have over 300 staff. We supported the largest portfolio of COVID vaccines globally, with 7 of those vaccines achieving licensure and 4 achieving WHO pre-qualification or emergency use listing. And of course, we conceptualised and co-founded and co-led the global vaccine sharing facility, COVAX, which delivered just a whisker shy of 2 billion doses of COVID vaccine to 146 countries, saving an estimated 2.7 million lives. So COVID-19 transformed our mission and helped us to define how we would fight future epidemics and pandemics. And that's where the idea of the 100-day mission came from. And it's taken off. The G7 has adopted it, the G20 has adopted it, and leaders of biotech, pharma, we could go on, national strategies, plans around the world are now focusing on the 100-day mission. And we've actually mapped out what it takes to deliver the 100-day mission. And if I can continue with the skating analogy, we found that it has a lot to do with reducing friction. I don't know whether you've ever been hit by a 200-pound man on a set of skates as he comes at you. That's the force of an absence of friction. It's about removing barriers, delays, bumps, things that slow the system. I'm sorry, that shouldn't be up there yet, but doesn't matter. And what we know is absent partnerships, alliances, and speed, we are slow to respond. So we actually need to reduce this friction to respond to all of these threats. We need to go to where the puck is going. Now, I don't want to suggest that the 100-day mission is just about attaining speed for speed's sake. It's about speed to save lives equitably. It's about saving the lives of people wherever they live and who would otherwise die while they were waiting for help, waiting for tests, waiting for medicines, waiting for vaccines. And Dr. Kang yesterday talked, I think, eloquently about the importance of equity. So I want to tell you now a story, and it shows how preparedness works and what the benefit of the 100-day mission is, the thinking ahead, the reducing of friction. Marburg. You'll have heard about it. Some of you may be involved in the response. And the outbreak of Marburg in Rwanda is, on any measure, a serious issue. It's a horrible disease. Filovirus causes a severe hemorrhagic fever, and just like its more famous cousin Ebola, it causes significant death. In previous outbreaks, it has killed 88% of people who are unfortunate enough to get it. Now, the good news is, and you may have heard about this, that we, working with colleagues, within 10 days of the Rwandan health minister picking up the telephone to alert the WHO, us at CEPI, and a number of international partners, within 10 days, vaccine was shipped to Kigali and was administered to frontline health workers as part of a clinical trial. 10 days. Compare that to Ebola in 2014 in West Africa. In that outbreak, it took 10 months to get vaccine to people. And during that long delay, there was relentless spread through Guinea, Liberia, Sierra Leone, and a number of other countries. It racked up a total economic burden of an estimated $50 billion in one of the world's poorest regions. And almost 30,000 people were infected, and more than 11,000 people died, while they waited for medical countermeasures. So in the 10 years between these two filovirus outbreaks in new countries in Africa, Guinea in 2014, Marburg in 2024, we have managed to reduce our response time in this instance from 10 months to 10 days. And of course, Rwanda is still working round the clock on this outbreak. And I think it's important, as Dr. Tedros reminded us the other day, that this is one of the world's most dangerous viruses. But the good news is, in this instance, people didn't have to wait. So that's the headline story. But now I'd like to talk to you about the backstory. I want to give you a sense of how we achieved that. And it's all about preparedness. It's about being where the puck is going. It's the backstory that actually gives a sense of the agility that is necessary, about the importance of reducing friction so that when we need to respond, we can. So as it happens, as part of CEPI's ongoing work, which I've said 100-day mission is at its absolute core, a delegation of our people visited Rwanda just a few months ago in August. Our team, including our Chief Executive Officer and our Executive Director, Preparedness and Response, as well as a number of experts in clinical development, trial design, operations, and regulation. They all participated, and they spent a couple of days in Kigali, including working alongside the Health Ministry and the Rwandan Biomedical Centre and a number of other international partners. One part of that visit, which was largely focused on Mpox, which, as you know, is another disease causing difficulties in Africa. But one of those exercises was a 100-day mission tabletop exercise. Essentially, it was a practice, a training exercise, the sort of thing that CEPI is able to do with many partners and many governments in many regions. And it's part of our work that does reduce friction. It creates new relationships, identifies barriers, bumps, bottlenecks, and smooths out or finds ways to overcome them. And of course, in a life and death emergency, when every hour of every day can cost lives, this makes a difference. We can skate faster, we can be more agile, and we can get ahead. So we worked in that context with including IQVIA, known to some of you, I've no doubt, and we signed, this was part of a strategic agreement we signed a number of years ago. So, when on the evening of Thursday, September 26, Rwanda's health minister called our CEO to tell him he was pretty concerned that they might have an outbreak of Marburg, that evening, the Rwandan government was able to put in place the practice that had occurred. They were able to call the Sabin Institute in the US because they knew that they had a potential vaccine candidate. And the next day, the outbreak was confirmed and communicated through a number of channels. Now, I'm sure many people in this room have pulled all-nighters. That will be a term that is familiar to you. And so people here worked literally round the clock, tirelessly. Officials, ministers, people in the WHO, people at BARDA in the United States, people at CEPI, IQVIA, I could go on. You get the sense. And what was agreed, and we should now find our first... This isn't going to work. There we go. Oh, go back. So this is what was prepared as required for our first vaccine to be delivered. These were all of the steps that needed to be taken to have every proper protocol completed. This is what we looked like on the 4th of October. At 1 p.m. Eastern Standard Time, we even timed it. So these were the many things that needed to be completed. And that dashboard, which was set up and agreed, which was ready to go, there are 37 things on that dashboard. And in normal times, getting them all done and in place could take months, many months. And if you think about it, even during COVID, with people working around the clock, getting a green light on each of these things could take several weeks. But in 2024, in Rwanda, between the 4th of October and the 6th of October, and we're talking, therefore, a series of hours, thanks to political will, practice, preparedness, and willingness to engage in multiple processes in parallel, this dashboard turned from having only 4 green lights to having 37 green lights in less than 48 hours. So, on the 5th of October, the first 700 doses of Sabin's candidate vaccine arrived in Kigali, and vaccination started the next day on 6th of October. And since then, a second batch of 1,000 doses has arrived, meaning that as of Monday this week, the 21st, a total of 1,017 vaccine doses had been administered to health workers and others in the front line. Now, I want to make absolutely clear, this is not a CEPI achievement. This is not an achievement of one particular organisation. This is the achievement of many individuals, many organisations, and the factors that enabled this to be achieved go to the reduction of friction, the cooperation, and the vision and drive of the Rwandan government. And I think we should acknowledge that by the Rwandan government taking charge, having the systems in place, this is an absolutely groundbreaking achievement. They have seen, the Rwandan government, the importance of health security and systems as being a key focus. They have a sophisticated early warning and surveillance mechanisms. They actually use AI-powered disease modelling systems to track and monitor outbreaks. It has expanded health facilities and has a large number of dedicated community health workers. And then there are the multiple partnerships that they have nurtured, established, and grown, which are part of their commitment to health security and preparedness. But what I'm saying is that all of these critical elements, all of these innovations and ideas for preparedness, the knowledge, the collaboration, the cooperation, the science, they're all interwoven in the 100-day mission. They all reduce friction. So I hope that you've gained some insight into what a significant achievement this is. Most people in the world will never fully appreciate what it takes to deliver that kind of response. And I'm sure you appreciate that this is remarkable. A nationally led, globally supported, swift, and here's the word again, equitable response to a novel outbreak shows us what a proactive approach using the 100-day mission as a game plan can help us achieve to get ahead of epidemic and pandemic threats. We've heard a lot here about science. Science is the foundation of our response. But as was acknowledged, we need many sciences we need cooperation. So if you think about it, if we are to go from vaccine policy to health policy, health delivery and response, we need the science, we need the systems, we need to practice, and most importantly, we need the vision to be where the puck is going. Thank you.